Hey YouTube family, welcome to another episode of The Casual Pharmacist. This is a channel where we talk about prescription drugs, over-the-counter drugs, and really other hot topics that pertain to the world of pharmacy. If that's something that interests you, hit that subscribe button down below, and then without further ado, let's get into the video. So the topic of today's video is going to be about the drug Norvasc, or the brand name for Amlodipine. Now, one way you might have found my channel is you may have been recently given a prescription for this drug. If so, you may be kind of wondering, why did your doctor give you this medication or prescribe it to you? And so I'm going to help you try to break it down for you today and make it a little easier for you. Now, Norvasc was originally discovered and patented back in 1982 by the drug company Pfizer before it became officially available to the general public in 1990. Now, Norvasc has become one of the most commonly prescribed drugs when it comes to controlling hypertension and high blood pressure. So Norvasc is part of the drug class of a calcium channel blocker. So essentially what that means is after you take it, it actually prevents the calcium from binding to certain receptors in your blood vessels and in your heart. So this actually causes the blood vessels to relax, as well as the cardiac and the heart muscles to relax as well, thus decreasing your blood pressure. So a lot's actually changed since I graduated pharmacy school when it comes to the guidelines for controlling high blood pressure. These guidelines kind of get looked over, reviewed, tweaked every other year or so, and so you always have to stay up to date and make sure you're on top of it. And one of the biggest changes I've noticed since I graduated is just how much more control and how more tightly regulated those guidelines have become. So now we've always heard that the best blood pressure to have, the best blood pressure to have level is less than 120/80, which still holds true. But now people are taking a much more aggressive step in helping to control it now when it gets a little higher than those little levels. Now when people have blood pressures over 130/90 or greater than 140/90, this is when these kind of medications become more applicable to you. And so chances are your blood pressure ratings have been greater than 130/90 for the past 3 to 6 months or so. And so your doctor now has deemed it necessary for you to get this medication. And so by now you're probably wondering, well, what are some of these side effects of the drug? Well, I got the answers for you right here. Some of the more common side effects of the drug are actually dizziness, low blood pressure, and flushing. Now, obviously, you're going to have a lower blood pressure for taking this medication, but you always need to be more careful when you first start out with this drug, because until your body kind of adjusts to it, you can be a little unbalanced, a little dizzy. Obviously, when you stand up, chances are there's always a possibility you could fall over, and this is going to be obviously more dangerous for those who are a little older and already have bad equilibrium. Now, one of the more serious side effects is actually peripheral edema, which is the swelling of your arms or legs. Now, if this does happen, you need to stop taking the medication and talk to your doctor immediately. So that wraps up today's video. Hope you all enjoyed it. Hope it was kind of educational. If y'all like the content, remember to always subscribe down below, hit the notification bell so you can always be aware of my future content, and always hit that thumbs up button. Thanks so much.